everyone. I am Dr. Brijesh, Shrivastava, cardiologist from Bhopal. Today I shall be telling you about the role of ambulatory blood pressure monitoring and what is the importance in the management of blood pressure. So ambulatory BP monitoring, that is in short we call it as ABPM. It provides a 24 account of the patient's state, blood pressure state, and it's useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes of hypertension. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurements using home or ambulatory BP monitoring is recommended in patients with office blood pressure classified as a high normal BP or grade 1 hypertension, which is systolic blood pressure between 130 and 159 and diastolic blood pressure between 85 to 99 millimeters of mercury. Ambulatory blood pressure monitoring provides the average of blood pressure readings over a defined period, usually 24 hours. The device is typically programmed to record BP at 15 to 30 minutes of intervals, and average BP values are usually provided for daytime, nighttime, and 24-hour hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable BP recordings are required for a valid ABPM measurement session. ABPM values are on average lower than the office blood pressure values, and the diagnostic thresholds for hypertension is more than 130 by 80 millimeters of mercury over 24 hours and more than 135 by 85 millimeters of mercury for the daytime average and more than 120 by 70 for the nighttime average, all equivalent to office blood pressure of more than 140-90 millimeters of mercury. What are the advantages of ambulatory blood pressure monitoring? Advantages are, it is a better predictor of hypertension-mediated organ damage than office blood pressure. 24-hour ambulatory blood pressure mean has a consistently shown to have a closer relationship with morbid or fatal events. More sensitive risk predictor than office blood pressure of CV outcomes such as coronary disease or fatal events and stroke can be predicted better. It can identify white coat and masked hypertension, and it has a stronger prognostic evidence. Nighttime readings are more frequently recorded and better to judge the blood pressure fluctuation in the patient. It also helps in the measurement of real-life settings. And it has got the additional advantage of the prognostic BP phenotypes. And there is abundant information or abundant data from a single measurement sessions, that including a short-term BP variability. So that's very important during a ambulatory blood pressure monitoring. Now coming to the disadvantages of ambulatory blood pressure monitoring, sometimes it is expensive and it has a limited availability. Sometimes it can be uncomfortable to a very active patient who is very used to, go to office, traveling and all that. So it might have some inconvenience while doing your performing your day-to-day activities. But ABPM has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from the European Society of Cardiology recommend that diagnosis of hypertension should be based on repeated office BP measurements or ambulatory blood pressure monitoring if economically feasible. Analysis of various indices on the ABPM graphs such as hyperbaric index, diurnal index, dipping and other indices can provide useful information about the prognosis of diseases such as hypertension, diabetes mellitus, and chronic kidney disease. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help in direct the treatment of such patients when required. So overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. Thanks a lot.